This is the Motherlands podcast. The intention of this podcast is to provide evidence-based information related to fertility, pregnancy, childbirth, and postpartum, as well as share positive birth stories. I am your host, Keely Semler. Global fertility in both men and women is in rapid decline. Estrogen dominance, declining sperm count, miscarriage rates on the rise. How do we as a culture make sense of this? And what are the options available to people who are trying so desperately to conceive? I sat down to chat candidly with Kristina Dahlin, a physician assistant and homebirth midwife assistant, to discuss the process of IUI and IVF and the social and emotional implications fertility treatments have on women, as well as the stigma around the cultural belief that fertility is merely a female problem. If you are interested in learning more about fertility and the preventive measures one may consider when trying to conceive, please visit my website, www.keelysemler.com. Please note, this is not medical advice. So today I have Kristina Dahlin joining us to talk about IVF and IUI and the process, everything involved, just a general conversation around fertility related to women's health. So thank you for being willing to talk to me and share your wisdom. Kristina is a physician's assistant and a midwife assistant. Is that right?
That's right.
What else am I missing?
Nothing. Just all the other little certs that you have to get to not be scared every day.
You're also a mom. We can't forget that.
I am a mom.
How many kids?
I have 3 kids, and they're all girls, and they're very cute.
I love it. I love it. Can you speak about what IUI and IVF is and just sort of, if someone you loved was planning to begin their journey to conceive, what would you tell them is the first step or steps in understanding their fertility?
So everybody I love has gone through fertility issues. And it is definitely, I have not. I conceived all my children naturally. I have had 4 miscarriages, but that doesn't put me even in the same plane as my ladies who've gone through IUI or IVF. And that's like a huge misconception. I've done a ton of research on how to be a good friend to people who are going through fertility issues and IVF. There's lots of really interesting coined phrases. One is IVF is a silent friend killer. If you're going to start IVF, it's a graveyard for friends and family, because it is such an emotionally aggressive and mind-altering medical procedures that you're going through. I think before, maybe even like 6 months ago, I'd be like, well, make sure that you can afford it or get a loan. Now I'm just like, I think that there needs to be therapy. I think there needs to be group therapy. I think that providers and doctors need to say, look, if we're really going to go down this road, I want you to bring in your closest friends. I want you to bring your family, and we're going to sit here for 1 hour, or I'm going to come over and I'm going to tell you how devastating this process is. Is it beautiful? Is it amazing? Of course. I kind of even hate talking like this because people are like, oh, you're being so extreme. But again, this is from my personal experience. I've had several friends go through this, and it has destroyed a lot of their lives. I know a lot of marriages that didn't make it, partners that have broken up, going into debt, losing everyone who's close to you. I mean, it's a very devastating experience that I have never heard one provider say that.
It's amazing that so many people go through IVF thinking that this is just how it is. I guess what's so devastating for me is that there's a lack of awareness or education around understanding fertility until it's so devastating. And I think, what is it? On average, a doctor tells you or tells a patient that they have to try to naturally conceive for up to a year, but doesn't give any more
Insurance
information.
won't pay. They don't pay anyways. But just to get the tests, to get the labs, you have to prove for 12 months we've been actively tracking and trying. And think for somebody who's 42, someone who is 44. A year means a lot.
That's huge. Yeah. But what's fascinating to me is that what are they doing in that 1 year? They're just trying. They're just shooting in the dark. And I guess, so I have this new one-on-one program that I am doing, which is talking about and working with clients, understanding their nutrition, because that's a missing piece. No one seems to talk about how important nutrition is when it comes to fertility. And we can talk about this once you get pregnant. Doctors don't spend any time talking about nutrition. Midwives are a little different. Midwives do talk about nutrition. But yeah, can you speak to that at all about fertility and nutrition? And
so I have links that we can put in the show notes. And the thing that I also want to say, which is difficult because we know each other from the birth community, but IUI and IVF, it can be natural. We can do alternative stuff, but it is truly extremely medical. So I think that's a difficult thing too, because like for you and I, we want to be gentle. We want to offer the alternatives. We want to be aggressive when it comes to good care, but not aggressive and like, you have to do this or you won't succeed. So that's why IVF is really confusing. And infertility is extremely confusing because you have to be so aggressive. I actually have lists of what a bunch of my friends have followed. The upwards of 30 to 40 medications, supplements, vitamins. They don't eat anything. I mean, they cut out and they have to, because I'm talking our sunscreens, face lotions that we've always used, a little bit of sugar, because when you're spending that amount of money, which I think is something we really need to be talking about on the daily with this conversation, because imagine that stress. Yes, I've had miscarriages, but I didn't spend $50,000 for that miscarriage.
Right. Well, I guess for me, as a female health educator and doula, my question is like, when do we go from like the holistic, natural alternatives, understanding your body, understanding nutrition, educating yourself on that, to now we're in a medical environment. Now that's just what it is. It's clinical. This is how the only way you're going to be able to achieve having a baby. Like, it's so black and white. And I feel like there's just so much gray. And by the way, let's talk about all the tests they do, because these tests are not 100% accurate. Like someone's anti-Müllerian hormone, that's a snapshot of what's going on. That's not the full picture. Am I right, or what do you think?
I think that the culture around infertility is so stunted and it is so dark. Like you said, black and white. It is black and white for what we can offer at this time. So I think let's go back to the basics. I think if you have a client over 35, 3 months, I've been tracking, I've been trying. Let's start that conversation around 3 months. Okay, I'm going to give you 6 more months because I hate to say it, but in the medical world, that's what we kind of do. Over 35, I'm going to give you 6 months. If not, I want you back in. We're going to start off, we're going to test you, we're going to test him. All your hormones. Okay, we're going to do ultrasounds. Is there a polyp? Is there a fibroid? Maybe your uterus, maybe your ovaries have too many cysts on them. Let's get rid of those. So there's those pre-surgeries. Because I hate to be the one that's like, the clock is ticking after 35, but I have had so much experience with people trying to get pregnant and doing IVF that I have changed actually my practice. Like it was there's a lot of stigma. Again, I'm going to be 42. I would never in a million years have told friends, patients, clients, you're 28. Are you going to have kids? I really want them one day. Let's freeze your eggs. Call work right now, or I'll call them and see and ask HR if they'll do it. I mean, if someone would have said that to a few of my dear friends when they were 36, we'd be like, what? We've never even heard of that. Is that like $1 million? And now I'm such a huge proponent because I've seen people suffer and they want a family.
Well, it's also like, why why is the weight of this issue always on the female? Because men contribute to about half of
40%. 40%.
Yeah. Of all of infertility.
And women are 40%. So that's
It's
80 together. And the other 20 is just up to, it's a mystery, right?
Yeah.
I really believe in the mystery of medicine.
Yeah.
I could do everything in my power to help you, and it still might not work.
Right.
You must know that and accept that. Well, men, we're on an upswing now. We're talking about it more. We're testing the man right away, and we're telling him this has nothing to do with her. This has to do with you. So what can we do? You guys need to go as a couple. Can we get a donor? Because we'll find that donor sperm. Should we do that now? Does the baby have to look like you? Are you uncomfortable if another man's sperm is inside of her? I mean, I'm having these conversations right from the get-go. But I'm also coming from a place, and this isn't right. I'm coming from a place of hurt.
Right. So let's, I think what would be helpful is talking about some preventive measures so that people hopefully, now IVF is seen as like the first line of like, oh, we can't get pregnant, but like, what about men and understanding like hot tubs and being in hot tubs all the time, or heated seats in the car, or sitting with a laptop on you? Like, I mean, it sounds silly.
No, it's not.
But we don't talk about that.
I know, because it's really big. And it's like also very funny and embarrassing. Like, I'm laughing right now when you're bringing it up, but it's like really true. But I mean, we would have to start. Okay, so we're in a new generation, right? So we would have to start now with the 20-year-olds and say, look, you really need to be careful with your sperm. But men, since the dawn of time, they have never had to worry or think about that. So you're changing epigenetics.
I know, but don't you think it's a missed opportunity? Like, if I had a son, I'd rather have that difficult, uncomfortable conversation about protecting his sperm than to not, and he is not able to conceive with his partner.
But I'm saying it's now. Like,
right.
Am I going to have that with my 50-year-old patient? I might, sure, but yeah, he's shot those guys down, or he's he's already in that hot tub. He's drinking his like old fashioned. Like, it's a new time, and we're definitely doing it. But basically 50% responsibility. A man, even the most open-minded, your partner, my partner, who are amazing. If we said, it's 50% of your responsibility if I had all these miscarriages. That's not on you. That's not to blame you, but that's such a new concept for them. Yeah,
well, maybe we should say this over again so any brave men listening are aware that they can be contributing to miscarriage, and that it's not just your wife or your girlfriend's problem.
And if you're a man and you're actually listening to this,
thank you.
And we you're our best friend.
Thank you. We love you. Keep listening, please.
I mean, but do you see, it's wild when I actually look at the numbers and do the research globally, but let's just stay like in our nation, the wonderful nation of the US of A. I have, even when I read it, and I'm from a little bit of an old generation, I'm like, really, men are 50% of the issue. Do you know I don't even believe it? I don't even believe it. And I'm like a women's advocate. I love women, because I really say like, I can't even believe this. And then I look back like, who did this research? And I'm like, oh, the best researchers in the world. And then I keep looking at their resources. I'm like, wow, 40 to 43% of infertility is men. It blows my mind. Like, I don't even want to say it. I want to take it back because I don't want anyone to hear me say that.
Yeah. Like, it's much easier to manage if it's just women, because we work with women and we can help, bring awareness to that. But I find that like the conversation around men, because of just how much we live in a patriarchal society, like it's difficult to accept that, and it's difficult to know how to articulate that publicly.
Like, I know men, and I don't want to knock them because, you know what? I love men. Like, I really do. But, I mean, not really. But, who won't even get tested, and not because they're evil, but because they're like, oh, I have to get tested. Like, why would I have to get tested? Well, I don't want anyone like touching my junk. And it's like,
or also like, I feel fine. Yeah. Like, this isn't my I feel great.
I've never had a problem before. And it's like, oh, so how many kids do you have then? Because like, no, you don't. So
Yeah.
we need to test you. So it's such a shift. This is a shift, not only in culture, not only talking about, this is a shift in the cosmos. Can we shift that? I mean, some days I'm like, yeah, cosmos, universe. And the other days I'm like, nothing's ever going to change. You know,
Well, I feel a couple different ways. On the one hand, I want to feel optimistic because I think the more we talk about it, the more it becomes public information, public knowledge. On the other hand, these doctors, these reproductive endocrinologists, these pharmaceutical companies, they don't make money if people can get pregnant naturally. Okay, so let that sink in.
She said, okay, so here's the thing. I am optimistic, but unfortunately, infertility, if you can't get pregnant in your women, you're shamed. So women aren't talking about it because they feel so much shame. And they're also on tons and tons of hormones. That's the body snatcher, and they're monsters, and they take every part of you away. Because let's say for like my husband and his friends, once they have a face to name all of this, the pain they see, my friends, their friends, women who are like, we have gone through so much. Now they're like, oh my gosh, we care. I'm a big advocate. But the problem is we can't find the IVF women because they're so destroyed who can speak up. They've also been abused by the medical system. I haven't heard, and I'm very open. I love medicine. I love systems that help people. I'm always optimistic, but I haven't heard one beautiful story where they're like, wow, my OB was like so amazing and made me feel 1,000,000% every time I left. And even if I had a miscarriage or the transfer didn't work, they understood me. I think that might be a made up dream. So the cycle of shame, that's the root of it. We have to get rid of the cycle of shame and feeling I'm not good enough. I can't even do the one thing that a woman can do. That it's just starting at the very beginning. Like, look at, if you can't get pregnant, we're going to do the best that we can, but you're still worth it. And if you really, I understand that dream is gone, that you wanted to conceive naturally or you wanted to labor and have a baby. Like, how do you really deal with that? How do we deal with insecurity?
I don't know. I think it goes back to like providers and training and understanding like emotional support management. And like people hire doula to have a healthy pregnancy and birthing experience. But that's why also doulas are important in fertility journeys too, because they can sit there across from someone and acknowledge the pain around that experience.
Look what we're up against. Insurance doesn't even pay for this.
Right.
So what's that message? You and your dreams, you and your chronic disease, it's not worth it to me. But erectile dysfunction is, and I'll pay for every single thing, even though the percent of men with erectile dysfunction doesn't even hit compared to infertility percentages. So the message that no matter how genuine we are and sweet we are, the message in our nation is you're not worth it.
And you don't matter.
You don't matter. You have a chronic disease and like we're not paying for anything.
And also we can't help you.
Yeah.
Yeah.
Like I'm not even going to pay for your labs. That is the story. That's what we're up against. We're up against a wall. I'm going to say it. We're up against an evil wall. I truly believe that. So for birth workers like ourselves, you know, we're sitting here and I'm not just combating somebody feeling badly because they can't get pregnant. I'm combating, honestly, people hate this, but it's a spiritual, I take it, it's a spiritual thing. How do I make you know you're worth it? And also, but do you have $150K that we can use to get you pregnant?
Yeah. How many patients have that in their bank account or access to those resources? Because that kind of cuts.
I don't work in that population.
Yeah. I mean, I would say more than 50% of my clients as a doula went through IVF. I've had clients tell me they have gone through 2 to 3 years worth of IVF treatments. And so my next question for you is, if someone is able to have a successful transfer with IVF and they're able to get pregnant, Do you think that inherently makes someone high risk in pregnancy?
That is such a great question. And I grapple, I'm not kidding. I have this conversation with myself a few times a week, because when I hear that and then someone's like, oh, I want to have a home birth, I'm like, no, you must be in the hospital because we paid $50,000 for this and we almost lost our friendship and you and your partner aren't going to make it and you can't buy that house and you're so scared and you lost 1,000,000 pounds and I haven't seen you in 3 years. Be in the hospital, it's safe. And then I have to be like, wait. Are they high risk? I don't know. I'm thinking of it as a high risk emotional situation. So how do we divide that? It has been such a high risk for quality of life. But could the female body do it? Sure. But I don't know a lot. I'll be honest with you. I don't know a lot of midwives who take IVF patients.
Really? Because I've done a lot of home births.
Yeah, I think you know way more about this than I do.
Well, I don't know if I know more, but I think in terms of my clients, I've had a lot of clients with successful home births that went through IVF. But then I have a lot of clients that are like, I'm not risking it. Like, why would I risk it? Not that it's risky to give birth outside the hospital per se.
It's not.
But when you spend $150,000 to get pregnant, how much risk do you want to assume? You know, knowing the context of that situation.
I don't want that because this couple is already broken. They have the demographic I work with, they've spent their life savings on this. Even the weight of the emotions and the spiritual side of that, it's like, just go to hospital, do what you got to do and just like get the baby out. But why do I think that way? I don't know, because guess what? In the home, it's wonderful and we do what you got to do and then the baby comes out.
Right.
But there's such a, I'm going to say this right, aura. There's such an aura around IVF and I'm constantly trying to like break the bubble on that. And I'm very happy because I coined a phrase. And it's called fertility-based bias, because I'm like, what? I feel like I'm up against a monster. And I would blame the individual because 75% of my friends have gone or had to go through IVF. For someone who's just like, I'm pregnant. We just like had sex on my birthday and it was fun. I haven't heard that story in years.
Well, I mean, I have some clients that are like 26, 27 years old that come from a lot of resources and they tried naturally and they went through IVF and they're 26.
See, I can't understand a lot of it, even though I look at, I'm constant for 2 years, probably I've researched this because I feel like I lost some of the closest people to me because of IVF. We're rebuilding. We're working on our relationship. Some of them, we had to let go of each other. There's a lot I don't understand, to be honest with you.
What are your thoughts around some of these fertility clinics and some of these reproductive endocrinologists? Do you think the regulations around their practices, and I don't want to put you in a tough position, I just want to know what your thoughts are on these fertility clinics and how they're being operated and from the inside.
This is a very crazy theory. I'm going to get a little QAnon-y, just kidding. But I think there is a component. Okay, so first of all, let me go back. Let me just answer the basics. I think they're far too expensive, but I do think that any sort of science, they're like mad scientists and that costs a lot of money to have a staff. And I understand that. And insurance doesn't pay for it. So they also need to survive. I think in general, these IVF clinics, they're amazing people and they want to help if you really listen to their stories. However, I think that it has been distorted by the American medical system.
And capitalism.
Capitalism, yes. I also think that there is a component to addiction in the IVF culture. Let's do one more round. Let's do another round. I'm going to push you to do another round. We can
From
do
the
this.
doctor or the patient?
Both. So I think that these doctors, their minds are amazing. the ones you really sit down with and you're like, wow, they're truly mad scientists. So bedside manner, communication, that is not IVF doctors' thing. When you're like, wow, it kind of should be, but they're truly trying to take a body that is infertile and make it fertile. So their work is very demanding. But I think that, like you said, instead of being primed for 5 years, these patients that are having fertility issues, they're so desperate that they will listen to anything, they will do anything, they will be treated poorly, they will pay whatever they can, they'll take loans out.
Oh, yeah.
And at some point, I do think that providers have to say, you know what? We're going to take a break. We're not going to do this anymore. This is our last round. But you know, it on average, and I think this was actually from 2015, this quote, on average, it takes about 8 rounds for it to work successfully.
And on average, because I know everyone is different, on average, how much does one round of IVF cost?
$40K.
That's in LA.
Yes, in LA, and upwards of that. That's what I've seen. I've seen, like, if you've already, sometimes, let's say like 20 to 40, but I do think it's higher.
And that's for IVF.
Yes.
So what about IUI? And can you speak to IUI a little bit? Because I know that there are some midwives that do IUI.
I'm stoked on IUI. I absolutely love it, especially for like same-sex couples, women. And it's great. You can find anywhere from $1 to $3K. I think if you do it with a midwife, it can be $500. I think it's awesome. So what IUI is we take fresh sperm and then we put basically like a little catheter up into the cervix, and we take that fresh sperm and we pour it in, and we hope that what this does is just, it's a better chance of the sperm getting where it needs to be a little bit more quickly. I think it's awesome. I think that should be offered. I even look, I'm 35. We've been trying for 3 months. Let's do IUI. We can do it right here. I can do it right now. I'm a huge proponent. Let's do 6 rounds. Huge proponent of that. Mm-hmm. But I do think that I need to test the sperm, and I need to make sure that that sperm is actually working.
Right.
Because if I'm just shooting up sperm that's not working, then we're just going to get discouraged. So there is some background testing.
That makes sense.
Yeah.
So on average, IUI procedure can be a couple $100.
Probably with a midwife, but I think if you're going to do it at a fertility, last time I checked, I think it was like $1 to $3K.
In a fertility clinic.
But what's cool, if you do it with midwives, it's in your own home. I think there's less pressure. We still can send you out for ultrasounds because, you really want to see how many follicles are you ovulating. I want you to come in tomorrow morning because I just looked at the ultrasound. Like, there is a component to it. Like, you have to, you can just do the ovulation kits. And to be honest, those kits are pretty good. Like, maybe we're risking a little bit of not knowing everything perfectly, but you can use a kit and we can do 6 rounds of IUI. And if it doesn't work, let's move on to fertility. We tried the best we could on a good budget.
That makes sense.
I love IUI. I would totally get into doing it. So
can you talk a little bit about, as a PA, in order for a patient to have a successful procedure, whether it's IUI or IVF, what are the important components in terms of hormones? You mentioned follicles. What are the more important components that if someone who is beginning to do initial research on potentially trying to conceive, what should they know as baseline information about their body?
Diet, exercise, and track for 6 months. Just, I want to know when you ovulate. That's it. Give me 3 months, give me 6 months. That is the bare bones. And then we would go into lab work.
So tell me the lab work. What are you looking for in someone's labs?
For a man, we just have to do all his fertility stuff, his hormones, his testosterone. Basically checking, how is your sperm? There's 6 part of it. One of it really is like, does it wiggle? Does it travel? Is it moving quick enough? When it does move quick enough, how long does it stay alive? very basic.
Because it's true that, isn't it true that a lot of ejaculate already has dead sperm, and you want to make sure that there's live sperm too.
I want live sperm, but more importantly, I want to make sure that the live sperm can swim.
And swim fast, right?
Very fast, wiggle very, very quickly, because a lot of it is actually the movement, and is the sperm actually, because we could get good sperm, this is good sperm, but the sperm dies too quickly or it moves too slowly.
Right.
And we're seeing that a lot. Like it's just too slow. And then sometimes the tails are like all squiggly wiggly, and we don't need that. We need a propeller.
Okay, so that's for the men. And for the women?
So for the women, it's going to be hormone panels, thyroid panels.
So they're looking at estrogen, LH, FSH.
We're looking at
AMH.
We're looking at all thyroid stuff, pituitary. I mean, we're looking at all your hormones, and we're basically saying, you know what? Yeah, you're looking good. Everything.
Have you, I wonder what your thoughts are on this, but some of the research I'm doing is really kind of indicating how we live in a very estrogen dominant world. Like the food we eat, the environmental factors like pollution, pesticides, all that stuff is making both men and women's bodies more estrogen dominant. Can you speak a little bit on how having too much estrogen in your body can impact someone's fertility?
Well, yeah, because if you get pregnant and you have too much estrogen and not enough progesterone, you're going to have a miscarriage. But it's just too big. That's like a road I haven't gone down because it's too overwhelming for me. So I feel like you have to teach me all about that.
Well, I'm
like
not
the
a provider,
environmental stuff. And I mean, I know I'm like an Oprah generation. So I'm like, don't drink the milk because you're going to have hormones. Like I know, but I also just feel so overwhelmed because I'm like, we can only control so much.
Right.
And this is very like Darwinian, but I'm like, survival of the fittest. Does that come in? People don't like me saying that, but I'm like, let's say you've done 10 rounds of IVF. None of them took. You've spent all your money. You have a divorce. It's like, don't.
Would you be open and willing to share with listeners about the story of your first birth?
Absolutely. It's very funny. It's like nothing. So I got pregnant. I was working really hard, studying a lot. My husband at that time, the father of my children, he travels for work, and he was only going to be in town like for a certain amount of time. So I begged. This is why it's funny that I'm in the birth world. I begged my OB to induce me. So it's like, he's not going to be home. He's going to miss it. Well, that's okay too. But I'm like, I begged him. And he was like, stop. Because he's old school. He's like, I'm not going to. At 37 weeks, I'm like, she's cooked. She's full term. Let's get her out. Let's go. He's home. I want him to see her. And he was like, no, finally. He was like, I'll compromise with you. We'll do like 38 and 5 or something. And I'm like, great. So I went into St. John's. I had a great time. I brought all my shows, tons of snacks. That's when, in the old days, like, I'm not kidding, 25 people were in my room. My sisters, their boyfriends, eating the snacks. I mean, you could have as many people as you wanted. I was induced. They said, okay, we're going to put the Cervidil up to soften your cervix. Nothing's going to happen. 3 hours later, my water broke. I'm like, oh, I think my water broke. I got to like 5 centimeters, and then I was like, okay, give me a pit. Like, let's get this going. And then I was just throwing up because the pit was too strong. I had an epidural, but it wore off because she was sunny side up. So she kept getting sucked up. And I just love, my OB's this old grandpa, and I'm like, it's too long. He's like, she's fine. Like, she can stay in there. Don't worry about it. And I was like, can you just take me in for a C-section? It's too long. He's like, no. And then I was like, can you just use the vacuum? Yeah. Yeah. I was like, just use the vacuum her out. Like, he's this guy, her dad's got to go. Like, I got to study. I mean, my mind's just, I got to pass an exam. I've got student loans. Like, come on, let's go. He was like, you are too much. I'm going to lay down. He laid down in my room and just like fell asleep on the little extra. This room is huge at St. John's. And And then I remember a nurse, I just like call her a pirate because I was just so out of it then. I think I'd labored for like 36 hours. She kept getting sucked back up, but she was doing fine. And a nurse came and she like flipped on all the lights. And I remember she was like, we got to have this fucking baby. And I was like, oh my God. And she just like put her gloves on. And I think she just tore me right open and she ripped this baby out. Yeah.
Oh,
yeah.
My gosh. Okay, so for listeners, can you just explain when a baby's sunny side up, the whole like sucking back up into the pelvis?
Sure. So it's because they're, supposedly their chin's like knocking the pubic symphysis, the pelvic bone basically. So baby comes out up to nose, chin knocks, and they suck back up. So it's just like they kind of have to be smooth and almost like you're diving in. That's how we would want a baby to come out, like they're doing a little dive with their arms tucked under. But my first, she couldn't do a dive. So she was coming out with her chin flexed up and back. Like if you're trying to get rid of your double chin when you're looking in the mirror. And so she just kept knocking back and then sucking back up. She would knock. So she couldn't get out. So the nurse just, I'm not kidding, she ripped her out.
What does that mean?
She, first of all, I think she like tore my perineum. So she tore basically an episiotomy because I asked the doctor, I'm like, can you just give me a episiotomy? I mean, he wouldn't. He's like, you can do it. Like the body can do it. But I was already so exhausted. And she was just super aggressive and she came and she either did tons of, I know I tore, but I do feel like she like splayed my legs out, gloved up. She had huge hands. I just remember that. She put so much pressure on the opening of my vagina, basically.
And then, on the perineum.
On the perineum. And I'm pretty sure she did like a aggressive, not really prayer hands, but she just like did probably a tuck and just like pulled the baby out.
Wow.
She's like, this is too long. This is too long. Like, we just have to get her out. We're too busy for this. And I was just like, okay.
Okay, so your baby girl was born.
Yes.
And everything was fine. She was healthy. Everything was
great.
Good.
She was perfect. And I was just like, that was a great birth. Oh, she's out. And I'm like, she's out.
She's out. She's healthy.
But the mindset I was in is wildly different from the mindset I'm in now.
So what kind of mindset are you in now? Now that you attend births and you assist births and...
I have way more time to be chill because in those days I didn't have time for anything. In my mind, you make up these narratives, right? Like I don't have time to be pregnant, but I know I need to do that because I'm a woman and I'm 33 and that's what we're supposed to do and I'm getting old. So I didn't have time for it, but I'm just going to get pregnant anyways because it's what we're supposed to do. And now, of course, I'm like, that's so crazy. I thought that way, but I don't mind it. That was who I was. I was hustling. And now because I have 3, I've been pregnant 7 times. I lost 4 babies. My last baby was a twin. I lost her twin. I'm a totally different person. I just take my time now. And I have all the degree. I mean, I'm in my career, I'm in my addiction. So it's just different. Like if I got pregnant again, I would totally want to try for a home birth.
Yeah. So you had hospital births with all 3 of you?
All 3.
With the same doctor?
No, because I'm not, I don't even know my doctor. I didn't go to any point. I was just like,
Yeah.
I wasn't involved. My last one, she's 2 now. I was really way more tender in that time. And I was the most involved that I have been. It was like barely involved.
Yeah.
But like so connected. And I was just older. I was sentimental. So I had a miscarriage. It was really hard on me. And then I had gotten pregnant with her. And the twins. And then they thought I miscarried because I miscarried one of the babies. And they were like, oh, let's do a DNC. This baby is gone. This pregnancy is over. But then I didn't do any of my testing. I was like, oh, it's a miscarriage. I've had them before. And then for some reason, I think I had a UTI or something. I'm like, oh, I'm just going to go there. You have other orders in here. Let's do it. I'm like, let's do it. And then I got my labs back and my HCG was really high. And I'm like, what? Could I still be pregnant? And I remember going in for an ultrasound and the ultrasound tech was like, there's something in there. It could just be a sac. And I was like, oh, I'll just wait. And then I went in a week later and they were like, there's a heartbeat. And I'm like, are you sure? They're like, yeah, it looks like a flicker, but it was so early and small. And so I went in at 12 weeks, and my OB and all the nurses, they were like crying because they were like, there's a baby in there. There's a baby in there.
Wow.
We see the heartbeat, and they're like, let's just keep going. Let's just see how it goes.
Wow.
Yeah. And that's my last baby.
Your little 2-year-old.
Yeah.
Oh my
She's
gosh.
cute.
How special.
She's so cute. She's so cute.
Wow. Well, thank you for being willing to share your own personal experience.
Yeah. So we'll see. If I get pregnant again, you can be my doula. And
Right.
we will, if you're taking clients.
Yes.
And I'll try to do it at home. But
Oh my
knowing
God,
me,
that would be amazing.
I'll get in like 5 hours. I'm so tired. Like, let's just.
Well, fourth baby, I mean, that thing will just slide right out.
Yeah. Hopefully.
Well, thank you so much for coming on the podcast. And I'm sure this conversation will be very enlightening to some of our listeners. So thank you.
Thank you. I hope it was helpful.
Yes, I definitely think it was helpful. Thank you so much for listening. If you enjoyed this episode, feel free to share with friends and family and stay tuned for the next episode.